Today I want to really experience what Chat GPT or GPT-3 could do for patients. I mean, at the end of the day, we're all patients. We all have some healthcare concerns that we're going to have to inevitably face, whether it's a loved one or yourself. It's just the reality of the situation. And healthcare is a big concern in the U.S. It's not even just a concern in the U.S. It's actually a big deal worldwide. Pretty much every country I've been to, the topic of healthcare comes up. With that being said, today I want to explore, can you use Chat GPT or GPT-3 for delivering healthcare information in a patient-friendly manner? So that's what we're going to explore. I recently went to the doctor, and I recommend most people do that at least every 6 months, just to so you know what's going on in your body. And my blood glucose level was a 109. My physician or just practitioner, like health practitioner that I was working with, they didn't really explain it other than saying like, hey, you're going to be having diabetes. And I was like, I'm not going to be having diabetes. So, let's figure that out, why this is concerning, because I couldn't explain it to anyone. And yeah, I'm going to try this. I'm going to try just using GPT-3. Let's see what's going on here. See if this works. Okay. So this is actually very impressive. Like, having worked in healthcare and spent some time on the electronic health record side and seen some of the calamities that could ensue from misinformation, misdiagnoses, like just us not explaining health data properly and easily, you can easily find yourself in a bit of a pickle, not only from the physician side, but also from just being the patient, right? Like, if you don't understand what's going on, you might not care. And when you do care, it's probably too late, or it's gone too far. And having a tool that can explain what's going on with your health in a patient-friendly manner is like, this is the truth. Like, I'm actually really excited. Mainly because will actually have a revolutionary impact on the healthcare system as we know it. Imagine being able to go a little bit deeper if you didn't get the greatest education, especially on the medical side, and you don't know what all the acronyms are. And there's now a way for you to get the dialogue that you need to receive the medical information that's being administered to you in a way that resonates. And there's going to be a tool that pretty much all physicians and providers have at their disposal, nurses too, right? Where they can disseminate the information in a way that it'll be best received by the end user. Now, what's fascinating is, everybody doesn't read. We talked about that yesterday on the Everyday's entry with Ryan, and I agree with that. So getting this information in audible digest formats, getting it in images, getting it in videos, getting it in ways that I can easily synthesize it and understand it a little bit better, that's going to be a big deal. And so I'm fascinated and captivated by how that will parlay into the future here. But there was a doctor that inspired me to even do this. His name was David Keynes, and Dr. David Keynes had a post on Substack. I checked it out, and he gave several different use cases as to how you could use Chat GPT. And I thought it was fascinating because, again, I worked in healthcare for a little bit. I remember what it was like. It was oftentimes confusing for me. I didn't know half of the terms. I had to spend a lot of time reading and getting up to speed. And luckily, I had very smart people that could help me elevate my knowledge in near real time. So I didn't have to become an expert at most things. I just could ask, the experts around me. But seeing how, easy the information is just not just delivered, it's just insane. And so these are some of his dialogues, right? He says, "My leg is swollen after my kidney was removed. Should I be worried?" And if your leg is swollen after your kidney is removed, you should contact your doctor. Swelling in the legs is also known as edema, a common side effect of surgery. It can be caused by buildup of fluid in the tissues. However, swelling can be a sign of a more serious problem, such as an infection or blood clot. Your doctor will be able to elevate your symptoms and determine the cause of the swelling. In some cases, your doctor may recommend additional testing or treatment. It's important to follow your doctor's instructions, etc. Now, that came from a machine that doesn't even know you, and I could understand it. It made sense. It actually gave me an awareness to say, like, oh, okay, it could be several things. I don't have to go to Dr. Google, and I might not die, but I can prevent that by going out and just talking to my doctor. And the sooner the better. And we need that. We need that because preventative care is about information. It's about understanding when is it time to go to the doctor or the urgent care facility before it's an emergency room situation. So one last thing is Axios reported that, that ChatGPT recently passed all 3 parts of its U.S. medical licensing examination. And that's often a test that's taken by medical school graduates. So, people go to med school for several years and then they take these tests and then they become doctors or nurses or different medical practitioners. And ChatGPT, something that hasn't been with us for more than, God knows, 6 months. If that, it's barely been 3, to be honest. And if you count GPT-3, a little bit longer, but like last few years. And we're already passing your U.S. medical licensing examination. That to me is it's ridiculous. I'm gonna link to this study too in my notes, but this is, I probably could get, probably download the paper and have Chat or GPT just summarize it for me. I don't even have to read it. I will read it because I'm fascinated by it, but prompting is a way of the future. It's a skill of the future, but what ChatGPT can do for practitioners, I recommend if you're a medical professional to actually read this article by David Keynes, Dr. David Keynes. It's a good one. He's using it for a lot of different use cases in his practice. Some things are very nuanced. Other things are more applicable and widely usable, I think, in the industry worldwide, like writing letters to insurance companies if you need to fight a claim. If they say, like, hey, we're not going to cover this, and you're like, hey, this is what's happening, you do have now kind of equal footing, especially if you are a smaller practice and you don't have necessarily a large staff to deal with this. You might have 1 or 2 people at most processing claims and responding to claims, and oftentimes they're going to respond to the ones that are going to have the greatest economic impact on your business. In this case, you actually can respond to every claim because you become the editor, not the author, right? So with ChatGPT, you become a really good prompter. You prompt out what you need, and then it gives you a response that you're acceptable with, and then you edit and you submit from there. So this is a great article. My mind's still blown. I actually am probably going to start dialing in a little bit to LLMs, which is large language models, and we'll talk about that in another note. And I'm going to start to really get into the API and the developer side. So I thought I would use the ChatGPT interface, but instead today I'm using the playgrounds because I think you just get a bit more variability, and you can get a little bit more granularity on the actual control, and you can dial this in. And this is what the developers are using. So I want to see what tools they're using, because the developers are going to dictate how AI is going to be integrated in future products, services, and brands, and all different types of offerings. And even this healthcare one, again, I used to work in the healthcare field. This is one of those things where I'm like, dang, this could be a game changer. So with that being said, I'm gonna tap out, but I will catch you in the future. If you want my notes on all this stuff, you can find it all. It's gonna be at everydays.wtf/138, and I will see you in the future.